Hi everyone, welcome to researchmd.com. Dr. Pramil is here. I'm a physician practicing in the United States, associate professor of medicine, one of the large medical schools, also the chief medical officer. So now today we're going to talk about the procrastination and the health outcome. Okay, when you talk about procrastination, what is the first thing come to your mind? You always kind of think, relax. It's due tomorrow. Do it tomorrow. That's the motto a lot of people are taking, okay? Procrastination, when you look at the definition, you're putting off things even though you know that it's a worse outcome if you put it off, okay? Now, let's look at some statistics about procrastination. If you look all across the world, 20% of our population or more, studies have shown are procrastinators. Now, when you come to the college students, like anywhere from 50 to 70% of them do procrastinate. Some of them like chronic procrastination. Okay, so the recent studies, I think it was published in JAMA, it looked at the procrastination, looked at the health. The long-term health implication of these people. When you look at the population of this study was done in Sweden, around 3,800 Swedish college students were picked up for the study, and they administered the survey and they looked at the health outcome. I think they looked at around 18 health outcomes, and they compared it like what is there an effect or procrastination on the health outcome. So very interesting finding. Number one finding so the key findings in this JAMA study were the researchers found there's a big relationship between procrastination and the bad health outcome. The number one finding, is the psychiatric component. If you procrastinate, more likely you're going to be depressed. There's going to be anxiety, insomnia. That's going all of those indicators for depression or psychiatric component is very high. Okay, they also looked at the psychosocial factors, and if you procrastinate, most of the time you're lonely and your socioeconomic status is also low. And another important finding they found in these people is like they found most of them are complaining about upper extremity pain, okay, and then some unhealthy habits, we can say, like these people don't exercise, their sleep is affected, and so those are the major findings. Now let's look at, now we know there is a big association between the procrastination and the health outcome, and if you're one of those procrastinators, what can you do? Okay, the number one thing you should do is like, whatever task you have to do, make them into small chunks and try to attack it. Okay, don't try to do everything one at a time. Okay, and then you prioritize. You look at it and see which one is high priority, and the low priority you can kind of postpone it a little bit longer. And then other thing you can do is watch the time. Use it like a stopwatch, and maybe give like 45 minutes or 30 minutes. I'm going to finish it. Or you can make a calendar. The other thing to me is very helpful is I make a calendar for my whole day, starting from 7, like 5 o'clock in the afternoon. Exactly I know what I'm doing in that time. Okay, and the other thing you can concentrate on is like get people's help. If you have like somebody, like let's say if you have a friend, and then you can always ask for help. You also should have a motivation for it could be a financial reward, right? Or a better job outcome, or leadership position in the organization, or you can score really well and then go like higher studies. Those kind of things is also important. And then always you can have the psychiatric help. You have like a mental therapist or somebody can kind of help you to go through it. And then the last is you can also do some exercise like yoga for the mind. That's also very helpful. Okay, so if you procrastinate, just think one more time, look at all the bad health outcomes, definitely get some help, or all this more advice we gave you, put it on your on your daily routine. Thank you so much for watching. We'll be back with another presentation. God bless. Please subscribe.